everyone, and welcome back to the journey. As you can see, today we're going to be talking about hypoparathyroidism, but before we go ahead and get started, let's talk about what the parathyroid gland does in the first place. So to begin with, if you look over here in my demonstration, you have 4 different nodules. Those consist of the parathyroid glands, and it is located right behind the thyroid. So if I was to turn this around, right here in the front, because it's located in the neck section, right in the front, I have my thyroid gland, and right behind that thyroid gland, I have my parathyroid glands. Okay, so those are those 4 nodules that you see. Now you may say, okay, what is going on? What's the purpose of the parathyroid gland? So the parathyroid gland secretes a hormone, also known as parathyroid hormone, right? That's easier to understand or to remember. And it helps to regulate calcium and phosphate metabolism. Okay, now calcium and phosphates have a weird relationship, which I'll go on once I get into the actual disease process itself. But when there's an increase of secretion of the parathyroid hormone, there's an increase in calcium in the bloodstream. And the way how it's an increase of calcium, it's getting it through the kidneys, the intestines, or the bones itself. All right, while there's a decrease in the phosphorus. Okay, with that said, calcium regulates the output of parathyroid hormone. Now, what I mean by that is whenever the body needs calcium, right? I drew right here, this is my bloodstream. It's in orange, but just imagine that it's red. So I have right here my bloodstream. So whenever the bloodstream, right, has low amounts of calcium, right, it pulls and lets the parathyroid gland know, hey, we need some calcium within the bloodstream. I don't know how you're going to get it, but we need you to go ahead and get it. So the parathyroid gland is going to secrete the parathyroid hormone, which is then going to stimulate the kidneys, the bones, and the small intestines to give up the calcium that they do have. Because when the body has extra calcium, where does it get stored? It gets stored in the bones. When you're eating, or whatever it is that you eat, when the food breaks down, it may have some calcium within there, so that's why you'll see it in the small intestines. And as well, when your body has too much and it's like, you know what, we need to secrete some of this, create urine so that way we can pass some of this calcium, you're going to see it located in your kidneys. Now, the bloodstream is low and it needs some calcium, so the parathyroid hormone is going to stimulate the kidneys, the bone, and the small intestines to give up the calcium that they do have. So now, I'm just going to go ahead and erase some of the calcium here, some of the calcium in here, and some of the calcium here, right? And now, I have all that extra calcium that I need within the bloodstream, okay? So that's exactly what the parathyroid gland is doing. Now, when there is an increase in calcium, I'm going to have a decrease in my parathyroid hormone, which is going to cause a negative feedback. All right. So now, when I have a lot of calcium within the bloodstream, right, my body's like, okay, this is way too much. We don't need all of this anymore. So parathyroid gland, the hormones, I want you guys to stop. Decrease the amount of hormones that you guys are secreting, because we do not need you to stimulate the kidneys, the bone, or the small intestines anymore to give us calcium, because we have enough or maybe too much. So once the parathyroid hormone is decreased, right, it stops pulling on the kidneys, the bone, and the small intestines. And what it does is it sends it back, right? So now you have to deposit those things back here, here, as well as the small intestines. Okay? And that is how it regulates the calcium levels. And it also regulates the phosphorus level, because whenever calcium is high, phosphorus is going to be low. Whenever phosphorus is high, calcium is going to be low. So that's how they regulate those 2 electrolytes. Okay? So that is called the negative feedback. Okay? And then when you have an increase in the parathyroid hormone, right, you're going to have an increase in calcium, because I just showed you the demonstration here. When the body pulls on, it's going to stimulate the bone, the kidney, and the small intestines to put that calcium into the bloodstream. All right? And when that happens, what's going to occur is you're going to have way too much calcium than what your body needs, okay? And you're going to find yourself in a life-threatening situation where it messes up different organs, and one of the organs in particular is your kidney, because eventually you're going to have so much calcium into the bloodstream, right? The body is going to say, hey, kidneys, we need you to help get rid of some of this calcium because we have way too much in the bloodstream, right? So when all of this calcium is in the kidneys and has to be passed through the ureter to then go into the urinary bladder for you to excrete it, right? You find yourself having calcification, right? Where too much calcium is in one place, right? Eventually, they become like little crystals, little stones, and now the body has to try and force to push that out, which can cause obstruction, which eventually can cause renal failure, which you do not want. So again, that's why it's good to have a good balance, and that's exactly what the parathyroid hormone does. All right, so now we're going to go ahead and talk about what hypoparathyroidism is. All right, so it is an inadequate secretion of the parathyroid hormone, right, after interruption of the blood supply, or it could be because of a surgical removal of the parathyroid glands during a thyroidectomy, either a parathyroidectomy or a radical neck dissection. Now, again, like I said before, the parathyroid gland sits behind the thyroid gland, and there's no way of when something is going wrong with the thyroid gland and it's producing too much of the thyroid hormone, and they have no other choice but to get rid of the thyroid hormone, there's not really a way to kind of keep the parathyroid intact, because behind the thyroid gland is the parathyroid. And if the thyroid is the problem and they remove it, then the parathyroid is pretty much removed as well. So that's one way where we can have hypoparathyroidism, because whatever is secreted is a little bit that's in the body, and now we have no more parathyroid. Or they try to keep it intact, but it just never really functions the same, okay? Or atrophy of the parathyroid gland, which is shrinking or dying off of the parathyroid gland in itself. So pretty much any way where the parathyroid hormone is no longer working or producing less of parathyroid hormone, we find ourselves in a case of hypoparathyroidism, right? So clinical manifestations, which is also known as our signs and symptoms, which is also known as our nursing assessment, all right? What are we going to see? We're going to see hypocalcemia, right? We're going to see hyperphosphatemia, because remember, they have that type of relationship. When calcium is high, phosphorus is low. When phosphorus is high, calcium is low, right? So we also have numbness and tingling of the face, muscle cramps and cramps within the abdomen or in the extremities, all right? And before I get to that, why muscle cramping or the tingling, right? Well, remember, the muscles, right, need certain electrolytes to help open certain channels or gates, so that way contraction can take place. One of those electrolytes is your calcium, right? You need calcium to help with contraction. So when you have muscle cramping, where do you have muscles? Everywhere, right? So you can have cramping just about in your extremities and your abdomen, right? So with that said, you're going to have numbness, tingling, and cramping. Now, with that, you have two names, which you have a positive Shekabes or a positive Trousseau sign, or you can have both. Now we have signs of overt tetany, okay? So tetany is pretty much the twitching and the numbness and tingling that you get when you have low calcium, okay? So it's called tetany. So what are signs of tetany, right? It's going to be located in these areas. That's how you know that you have bad tetany, okay? So you're going to have bronchospasm, laryngospasm, cardiopedospasm, and then you're also going to have difficulty swallowing, because where are these areas located? Right here in the throat, right? Because on the illustration that I showed you, the parathyroid gland is behind, and these main muscles, right, that help with respiratory system, they're now going to play a part in the effect of low calcium, because now those muscles can't contract the way they're supposed to. They can't carry out their function the way they're supposed to. And what is the main thing, right, on your ABCs? Airway, breathing, circulation, right? If I don't have a clear airway because the muscles around there are trying to spaz and they're tightening, right? Where is my airway? Next to none, right? I can't get enough air in. My body is not able to contract and do what it's supposed to do because what happened? We don't have calcium, right? So those are your signs of overt tetany, all right? Tetany itself is just the twitching and the spazzing of muscles, and where they're located is these areas here, which are detrimental and is a very life-threatening complication that you do not want to have when you have a patient with hypoparathyroidism. You also have your photophobia, where they're sensitive to light. Now we're going to go ahead and continue on with the clinical manifestations. So another thing you can see is your cardiac dysrhythmias. Now remember, you have your sodium channel pumps, you have your potassium channel pumps, and you also have your calcium, right? So again, you have more than one electrolyte that's helping to help the muscles contract, and one of your biggest, greatest muscle, or very important muscle, is your heart. And if your heart doesn't have the electrolyte that is needed to help it pump effectively or contract effectively, you find yourself having this arrhythmias, right? So the next thing you also have is your seizures, right? With all that spazzing, eventually you have that overexcitement of the muscle in itself, and you can actually seize, okay? Because of a lack of the calcium and things like that to kind of help regulate the body. You also can find hypotension, as well as anxiety, irritability, depression, and delirium, okay? So these are your like psychological dysfunction that you can see with this disease process. All right, so now we have our diagnostic testing. And like I said before, our main thing is going to be our Trousseau sign, as well as our Chekovec sign. Now with a positive Trousseau sign, right, because you may say, what is a Trousseau sign? With that, it is a carpal pedal spasm, and your carpal pedal is in this area here. All right, so just start thinking about the arm. So carpal pedal spasm that is induced by occluding the blood flow for 3 minutes, either with a blood pressure cuff or whatever device that you may have. Most typically a blood pressure cuff. Sometimes you don't even need the blood pressure cuff, and you'll start to see that they're already spazzing as it is with their arms. But you'll put it on for 3 minutes or so, and once you see that twitching or that spazzing of the arm, that lets you know that that patient has a positive Trousseau sign. All right, now the Chekovec sign, right, is pretty much when you have a sharp tingling over the facial nerve just in front of the parotid gland, as well by the ear, and you're going to see a twitching, right, a twitching or a spazzing of the nose, the mouth, the ears, anywhere within the face, even the eyes. You'll start to see them twitching or having a spazzing or tingling. So they may say that, you know, something just tingled up their face, and then when you look at them, you'll kind of see the tingling or the spasm that's occurring. Okay. Now, with these two signs, it's very important to remember them, because these are your diagnostic findings, your main two diagnostic findings. So sometimes you may forget which one was the face, which one was the arm. So if you look at Chivastik's, right? Chivastik's has a C. What also has a C in its name? Face, right? So that's how you can kind of correlate. Chivastik's goes with the face, right? F-A-C-E, right? The face. And then your Trousseau, you can think of your arms, okay? Because within the Trousseau sign, you have an A. Okay, so arms, A, right, for Trousseau, or you can think of the letter T. The letter T is long. My arm is longer than my face, right? So the T for letting you know these are my extremities, right? So however you want to remember it, main thing is you have to remember it, right? And one more other thing that I can tell you guys. I remember when we had to do our 3-day review when we were in nursing school. We was getting ready to study for the boards, and the school had assigned a lady or instructor who does this normally. She goes and does reviews and things like that. Don't remember her name. Great lady, very smart, very enthusiastic. She definitely made learning very, very fun, and she had different like songs and mnemonics and things along the way. But one thing that I do remember that I can take away is the Chivastik's and Trousseau, because she actually had a song and a dance. So I don't know if I remember the dance part all the way, but whatever it takes for you to remember it, I'll do it. So if that makes me being an idiot on this video, as long as you get that A, then it's worth it, okay? So get ready. Don't laugh at me. All right, but pretty much it went like twitch, sees, Travassus and Trousseau. Okay, so she pointed because Travassus was the face, Trousseau was the arm. So when she put it together, she had a little dance song combo. So it was twitch, sees, Travassus and Trousseau. Okay, so I'll do it one last time. If you remember it, great. If you don't, you can look at the other two ways. All right, so one last time. Twitch, sees, Travassus and Trousseau. All right, now you may say, what is this girl doing? She looks like an idiot, but clearly it's very helpful because this happened years ago and I still remember this whole Travassus and Trousseau because of this dance and song that she created. All right, so don't know her name, but shout out to you. You're a great teacher, very knowledgeable, and thank you along the way because now it can now help someone else. All right, so now we have our lab test. Now with our lab test, you have tetany, all right? Tetany is pretty much like I said before, right? The spazzing and the twitching of different things, but when do you experience tetany is going to be when your calcium level is between a 5 and a 6 or even lower. Now normally your calcium level is supposed to be, some books tell you 8.5 to 10.5, other books tell you 9 to 11. I rather just go with 9 to 11 just because it's more of a solid number. You can remember that. Two odd numbers, 9, 11, rather than 8.5, 10.5. But either or, as long as you're in that area of levels, you're okay. All right, and then your phosphate level is going to what? Increase because calcium is down, phosphorus is going to go up. That's that relationship that they have. So continue on with the diagnostic testing. We have our x-rays that can show an increase in bone density. Calcification is also detected on the x-rays as well in the subcutaneous or paraspinal basal ganglia of the brain. All right, so all those things let you know, hey, there are increased calcium in those areas where there shouldn't be and not enough in the bloodstream. All right, so all these different things can point out that this patient may be exhibiting hypoparathyroidism. Now you have your medical management. What are we going to do now that we know that this patient does have it, right? Our goal of calcium level is to be between 9 to 11, all right? We're going to give IV calcium gluconate. Now with the IV calcium gluconate, we're going to give it slow and we're going to be cautious of it, okay, as we're giving it. Another thing that you can use is your sedative agents, right? One of the things that they have is your phenobarbital. Most doctors, I don't really see them use phenobarbital. A lot of times it's mainly ativan is the main thing, but you may have some doctors that are older and this is what they've been used to, so don't be surprised if you do see phenobarbital. I haven't seen phenobarbital. I mainly see, like I told you, ativan, but it all depends on what they want, but just know that they're going to have a sedative agent, okay? Some type of anti-seizure mechanism to it, all right? And the reason why you're going to give this is because if there is no decrease in the neuromuscular irritability or seizure activity, you want to give it immediately because you don't want them to constantly be in a spasming motion because eventually if you have too long of a seizure, the brain is deprived of oxygen and different things that the body needs, as well as you have muscle wasting, all right, which you do not want. Another thing you have is your parental parathyroid hormone. So these are hormones that you can be given. And what it is, it's an acute hypoparathyroidism, right? So when you have it like right away, with tetany, you want to monitor for allergic reactions, okay? So this is a mechanism that kind of mimics or stimulates like the parathyroid hormone that they can give. But again, you want to make sure anytime you're giving a new med in general, not just this med, anytime you're giving a new med in general, you kind of want to monitor the patient and see how well they're doing, if they're tolerating it well, and what's going on. Okay, so they have a parental route, which you're going to give that to them, all right? Also, you have tracheostomy, all right? That's the biggest thing that I can probably say that will be on a test question, all right? That will be a test question. So, on a test, most of the time, what should you have at bedside? A tracheostomy set or tray, as well as having a ventilator or mechanical ventilator close by. It doesn't have to be at the patient bedside for the mechanical ventilator, but definitely you want to have it close by on your unit if you are in ICU. For the most part, these patients sometimes will be transferred over to ICU just to be monitored for that reason in general, and then once they're okay, then we get transferred up to a PCU, step down, or regular floor. So with this case, you want to have them right away, because if they do go into the tetany and they have the bronchospasm or the laryngospasm, right, you want to make sure that you do not obstruct that airway and that they're able to, breathe. So sometimes in certain cases, you don't have time to hang the calcium, because look, the calcium has to be run slow, and this is happening right now at this instance, right, an emergency situation. So sometimes they may have to go ahead and either intubate, or if they are not able to because it's spazzing and it's hard to get to that, you may just have to go ahead and do the tracheotomy. All right. So just a tracheostomy, sorry. So with that said, we definitely want to have that at bedside, because you don't want a doctor yelling at you like, where is the kit? You don't have a kit at the bedside, all right? So definitely want to have that on hand. And you also have your bronchodilating medications like your albuterol, things like that, respiratory treatments, and that is in the case of respiratory distress to kind of help open up, right, that airway from spazzing. It kind of opens it up. It gives you opportunity to get the things that you need. All right, so we're going to just continue on with the medical management, and with that we have a high diet in calcium, okay? So we want to have increased calcium in our diet and a low or decrease in phosphate, okay? Because we already have a lot of phosphate as it is. Now, certain foods that you want to make sure the patient do not have or that are restricted is your milk, your egg yolk, all right, and your milk products. And you're probably saying, why are they going to be restricted? Don't they have calcium in them? We're taught, got milk, if you want, stronger bones, drink milk because of the calcium, right? But even though these products have calcium, phosphate is also within these products as well, and the phosphate level already is high, so you do not want to take on those type of products. And trust me, there's a lot of food out there that we don't even know that has calcium in them, that has higher amounts of calcium than the actual dairy products themselves. Another food that you want to avoid is your spinach, and the reason for that is because it contains oxalate, which is insoluble calcium. So when that breaks down into the body is not able to absorb or take on that calcium. So it's almost as if you didn't have any calcium at all. All right? Another thing is you have two medications. You have your aluminum hydroxide gel, or you have your aluminum carbonate gel. And what this is pretty much, or pill, sorry. And what this is pretty much after meals, you want to take this, and what it does, it binds the phosphate. So that way calcium could get into the body. So again, I'm going to use this demonstration or analogy. The same lady who I spoke of earlier when we had to do our 3-day exam to do the 3-day review for the exit exam for nursing school. Another thing that she told us was, think of calcium as your Southern Belle, right? She's a woman, she's very polite, and she has a seat, right? And she has several seats. And this calcium and that calcium, this calcium and that calcium, right? All of them are all Southern Belles. And you have phosphate. Phosphate is brutal. They don't care, and they're gonna say, hey, I know you're here, but I want this seat. And calcium is just gonna clearly say, okay, you can have my seat and get up, and phosphate is now going to be in its place, right? So when calcium constantly gives up their seat, what is left? A whole bunch of phosphate. So now we have a whole bunch of phosphate in our bloodstream, right? And every time we even enter calcium, the phosphate are not going to move. They're going to say, I'm going to sit right here, and I'm not getting up because you gave me your seat, and I'm going to hold on to it, and I'm going to just stay there until whenever. So when the calcium is entered into the body, when you're taking your high calcium diet and you're doing what you're supposed to be doing, and you're like, why is the calcium level still low? What is going on? Phosphate is not giving up its seat, so it's staying right there, and that calcium goes nowhere. So what happens is you need a phosphate bouncer, right? That's what she said. You need a bouncer. Someone, when you know you're in the club and you're not supposed to be there, what are the bouncers there for? To get you out, right? Or to make sure that you don't come in. So these guys, aluminum hydroxide or aluminum carbonate, what they are the bouncers. So they're literally saying to phosphate, get up and move. So they have to literally get them up and move them along. So they bind to the phosphate and make them get up and move. So now those chairs are now empty for calcium to come and sit. So now the calcium now is going to say, oh, there's no seat here, there's no one is there, so let me go ahead and sit down. And the next calcium does so, and the next one, and the next one, and the next one. And that's how you're able to lower the phosphate level and bring up that calcium. All right, so I know it's a weird story, but it makes a whole lot of sense, and it breaks it down to let you know exactly how this medication is working. It is a phosphate binder, right? It is a bouncer into the phosphate to say, hey, get up out your seat, you know, because calcium is a Southern belle. She's going to just give it up, and she's not going to argue. She's not going to fight to get the seat back. She's just going to leave you with the seat. So you need someone there that's going to be that bouncer that says, hey, you have to go. So the aluminum comes and pushes it out of the way so calcium now can sit down because all those seats are now free. Okay? Hopefully that makes a whole lot of sense. If not, you may have to play it over in your mind, or if you have another way to remember it, great. Okay? So you're going to take this after meals, okay? So you're going to take it after the meal, and then what it's going to do, promote its excretion, right? Phosphate excretion in the GI tract. So it's going to bind and pull phosphate out into the GI tract so that way it gets pooped out of you, okay? And that's how you get rid of the phosphate. Another thing is you're going to have various doses of vitamin D, because what helps calcium get absorbed into the bloodstream or the body in itself is vitamin D, okay? So it enhances the calcium absorption from the GI tract. So when you're ingesting all of this calcium and you're doing what you're supposed to do, you need your vitamin D to help move or get that calcium in. So you can think of vitamin D as the chauffeur to the calcium, right? Because she's such a Southern belle, she has her chauffeur that is going to help take her into the body, into the bloodstream, all right? And vitamin D, one thing our body makes vitamin D. As long as you're out into the sun for at least 15 minutes or so, your body is able to make its own vitamin D. So just get some sunlight, walk outside, go for a walk, go for some fresh air. If you're going to the beach, you can get plenty of vitamin D, right? Or you can take supplements if you realize that you're in New York, or you're in some place where you don't get much sunshine or things like that, or Alaska, right? Right? You can definitely go ahead and take supplemental vitamin D, all right? And that's going to help get calcium into the bloodstream. Another thing, call the physician. Don't ever be afraid to call the physician. Even in a case of emergency and you feel as if like you're unaware and you just don't know what's going on. I mean, not in a case of not of an emergency. Sorry, of course, in an emergency, you're going to call the doctor. In case of not of an emergency, if you're unsure about anything, lean onto your chargers. Call the doctor. There's multiple people there. You don't have to figure this thing out all by yourself. Nursing is a team effort. So it takes a group of people to help, everyone that's in the hospital. So again, call the physician immediately, especially for signs and symptoms that you're not sure of or you're seeing, or sometimes you just have that gut feeling like, hey, something is not right. I need to call. I need to say something. Go ahead. Call the physician. Call someone. All right? And last but not least, you're teaching. You want to teach your patient all these different things, because they may say, why do I need to take vitamin D? Why do I need to take this aluminum hydroxide gel? What's the whole purpose of that? So the more they know, the better they're able to treat themselves, the better they're able to care for themselves. So teaching. You want to let them know, teach them about what foods are high in calcium, or, bring the dietitian on board and that she can explain or he can explain exactly what foods they should avoid, what foods is good for them, things like that. You want to educate your patient constantly. And now with that said, that is pretty much it. If you like this video, go ahead and give it a thumbs up. If you have any questions or comments, please feel free to leave that in the comment sections below. Again, remember to check out my description box for added information and also for the link for my Instagram page. And again, if you have not subscribed yet, what are you waiting for? Go ahead and click that subscribe button. And again, thanks for coming on this journey, and I'll see you on the next one. Bye.